I don't know what the delay is, so.
Okay.
On the live stream,
Yeah.
the delay is like a good 4 or 5 minutes.
Oh, really?
Yeah.
Okay. Well, then
It's really short.
And I have a 303, 304, 305 running time right now.
I just did a camera switch too, just to see.
This is the old one. This is the new one. Oh, there's the sound. Yeah,
That's how long the delay is. Right.
we can be heard now. Everything.
anything more special? There is another family coming, but anyway, look, I want to welcome everyone and really thank everybody for being here. My name is Glenn Monis. I'm the Executive Director of the New York City Hemophilia Chapter. And we're very excited to be working with Patrick Lynch and with Ryan Gillen, with the whole Believe Digi crew, and of course with Pfizer, our very generous sponsor for this program, and a co-presenter who will be presenting the first major part of the program. You know, this is something that's never been done before. No one has tried to do anything exactly like this. No one has really, people stay away from doing activities that are sort of oriented more towards teens, partly because they know that, you know, teens like to do their own thing, and it's hard to, but it's needed. And we're hoping that by doing this and by pioneering this program, not only will it grow over the next 2 sessions, but it will attract attention, and other chapters will want to do similar things and so forth. So we really appreciate everyone for participating. I'm not going to run through what's going to happen. You're going to hear that from Patrick, who I'm going to introduce. But if anyone has any questions about what we do at the chapter, I do want to say our Vice President from our board is here, Wendy Chow. So hi, Wendy. And if anyone has any questions, we have a lot of activities. Everyone is always welcome. We have a gala coming up on the 23rd, a dinner here in New York, fundraiser, and then we have a whole education day on the 24th, which the second Breaking Barriers session will be a part of, and then there'll be a third session and some in-between stuff. So that's a huge day with like 300 people and educational sessions and a lot going on. So I hope everyone will make sure to be there. So at this point, that's all you're going to hear from me. I'm done for the day. I'll be here for a little while, but I'm very delighted to present Patrick James Lynch, who my friend and my colleague and everything else. Thank you.
Yay! Everything else. How's it sound? Does it sound good? Can you hear okay without the mic? Cool. So as Glenn said, thank you guys for watching. It's really cool that we actually have more people right now who are watching, I think I'm just right here, and participating live online than in person. And as Glenn said, that's never been done before. This has never been done before, and that's a tremendous success. So really quick, the reason that we're here, earlier this year, I decided to try to run the New York City Marathon, which is going on right now. I'm here, so obviously I'm not running it. I did find that that was a bit too much of a challenge for me, but by establishing a really high goal and then taking steps to achieve that goal, I did achieve a tremendous amount. I lost 40 pounds, I did run a half marathon, I found a love for hiking. So the idea of this program is to do the same thing, set goals, set high goals, and then use a plan, use each other, use support to achieve those goals, and to do so in a fun, dynamic, interactive way. So that's why we're here. The first thing to do, I keep wanting to go here, but I know I'm just right there. Sorry, guys. The first thing to do is to get started properly. Anytime you're making a change in your life, you want to start properly. So our very first presentation is going to be from our friends at Pfizer Hemophilia on the importance of medical adherence and living a healthy lifestyle in the theme of getting started on the right foot. That's the theme for today, getting started on the right foot. Hello to those that just came in. So if that's it for me for now. We're going to hear from them, then later on we're going to have a session with an Olympian athlete who was my trainer for a while, and he's going to work on some warm-ups and stretching exercises before we head off to the marathon. And in between, we're going to take some time to set up goals for ourselves that we hope to achieve over the course of the next 6 weeks together. So with that, I'd like to present Deborah from Pfizer Hemophilia.
Thank you, Patrick. My name is Deb Schachter. I'm with Pfizer Hemophilia. Thank you all for allowing us to come in and talk to you today. 2 things I'm going to do. I have a small bit of housekeeping. If there's anyone here that is a nurse or doctor, I just need you to sign in. It's just part of Pfizer's disclosure. Obviously, the people online don't need to do that. I don't think there are any nurses or doctors here, so I think we're good. And at this point, I'm just going to introduce you to Linda Paulhammer. She is our nurse educator specialist, and she's going to be the one running through the program and kind of explaining what you guys are going to do. So thank you. Have a great time. Now, do I?
You get the privilege of using this beautiful microphone.
I get to use the microphone.
Yeah, we like to use all our toys.
And
So.
and I also hope that I don't trip over this and fall in front of everybody. So can you hear me okay? Once again, my name is Linda Polheimer. I am a nurse educator specialist. I'm retained by Pfizer to reach out to the hemophilia community and present these programs. I think we now are going into our 4th year of these programs. When we started, we had none. So we reach out to you all to get some ideas, and this is certainly one of those, to talk about medication adherence and how we work to make sure that we're taking our medications as we should. A little bit about me. I always tell people just to start off that I've been a nurse for 100 years. That's all I know, that's all I've done. In that time, I've done everything from soup to nuts, hospital nursing, all those kinds of things. Before doing this, however, I got a chance to work in the home infusion business, and I absolutely had some hemophilia patients on our census. Little kids, older guys. So I have a feel for some of the challenges that you go through living with hemophilia. So let's just go ahead and get started. Let me get my clicker. The topic we picked today was the role of medication adherence. It's part of Living with Hemophilia community education series. And I'm saying that because here's one of about 9 hemophilia what do you call it, programs to reach out to the hemophilia community. So, having said that, I'm not the lecturer here, you guys. A couple of you have been to my programs before that's all about sharing, giving your ideas, and that's kind of how we learn. I'm not a lecturer. That's not what this is about, okay? Promise? Everybody has to speak up. Everybody has to speak up. So this is a promotional program given by Pfizer, but I am not an employee of Pfizer. I work for a company that is retained by Pfizer to, once again, to reach out to the hemophilia community to do these educational series. The object of this is not to talk about product. That's not what we're here for. We're here to talk about medication adherence this evening. And if you have some questions that are related to your treatments, I'm going to encourage you to write those questions down and take them back to your healthcare provider, be it a hematologist or your HTC. Okay? So let's continue. Some objectives is the role of medication adherence in healthy lifestyles. What does that mean to you as a hemophilia person? Reasons for non-adherence, and particularly among teens. Do you think that happens? I don't know.
Yeah.
You think that happens?
Sometimes.
I might have seen some myself.
You might have seen some
Yeah.
yourself. So we're going to talk about those kinds of things, and we need to share. And hopefully you'll go home today with a little bit of different perspective and maybe some better ideas how to become more enhanced to your medications, okay? So strategies for improving. So that's why we're here, to share and think and maybe come up with some new ideas, keep you adherent. So healthy lifestyle choices is certainly very important to hemophilia patients. Why? Okay, nobody has an answer to that question. Living certainly is, we have to be aware, okay, of what's going on. We have to pay attention. And then last but not least, you as a community have to do something about it or take some action, okay? So we're going to focus on making your life healthy, okay, and then productive at the same time. So if you're doing everything you're supposed to, then what? You have a more productive, happy, healthy life. So that's what we're looking for. So awareness, it doesn't mean just taking your medication. What does awareness mean? Come on, help me out. Yep.
Knowing your limits.
Knowing your limits.
What you can do that'll be good for you.
Yep. And how about knowing what's going on in the hemophilia community, keeping up on everything, you know, and keeping the eye out. Doing things like this, working with one another, sharing your thoughts and ideas with one another so that you can learn something new, right? You all are living it, sharing among each other, it helps you learn. So how about paying attention to health care goals? Do you think about that? What are some of your goals? Think about that for a minute. So what does take action mean? Yes, sir. You don't have to raise your hand, you can just shout it out.
To try to make an attempt to achieve your goal.
To make something that suits you and to achieve your goal, absolutely. So how about we're going to eat healthy and exercise? 99.9% of the time we're going to do that. I see some grins. We all have to cheat every now and then. That's just human beings. We're also going to, how about this, especially for teenagers, well, even adults like myself, how about sleeping, resting, kind of taking care of yourself? Do we do that? No. No.
Silence.
What? I know everybody's like, no. So using doctor replacement accordance to what you've been told or how you're instructed how to do that. Okay, can you do that by yourself? Do you have to work with your healthcare team? So you're making me do all the answers. So you really have to, you really have to work with your healthcare team to make it work for you. If they don't know what's going on in your life, they can't put together a good plan. So certainly we're going to do all of the above, but we want to adherence. If we adhere to our lifetime goals, because we want to have a good diet, we want to have exercise, and we want to take our medications like we're supposed to, right?
Yeah.
Yeah. Okay, so here is the World Health Organization definition of adherence. It says, the extent to which a person's behavior takes medications, following a diet, and or executing life changes in accordance with agreed, keyword, recommendations from your healthcare provider. So I'm going to say that over and over again. It's not just what you decide, and it's not just what your doctor decides, it's a team approach, right? Everybody's like, I'm telling you all the answers.
You're so knowledgeable, though. So we like the answers.
But I can't tell you the answers because you have to, it has to be a cooperative effort.
Oh, I have to participate in my own
Yes,
healthcare?
you do.
Oh, man, that sounds like work.
Absolutely. Well, of course it's work. And it's part of paying attention to your lifetime goals. Thank you. So adherence is however your physician prescribes it. Being an on-demand treatment, which means you give it as you need it, right? And a preventative. So regardless of the approach, regardless as to how your physician prescribes it for you, that's how you should do it. That's how you do it 100% of the time, right? 100% of the time? You're so good.
I don't believe that.
So, but my point again is, if you communicate to your physician when you go to your physician and you say, these are some of the challenges I've had, could you not be more compliant if you have that better communication? I'm going to pick on you. So, well, think about it. Do you talk to your physician and tell them and share all the things that your challenges in your life? You share everything with your physician and your healthcare team. Most things. Honest answer. That's fair. That's fair. So, some self-assessments. Food for thought. How do you follow prescribed treatment plan? Okay, maybe I should say if. How do you remember to infuse? In this day and age, there's all kinds of great gadgets and things to help you remember that. And when are you most likely to miss? That's probably a good question. You never miss, right? You never miss. You always do it exactly like you're supposed to. Your mom's going, yeah.
I miss when I travel sometimes. Do you ever miss when you travel? You kind of get off a routine. No? I'm the only delinquent?
Yep.
Oh, man. Anybody online ever miss when they travel? Anyone in the world?
Come on. Everybody in this room
Late
is
for
100%
school, late
compliant.
for work.
Never.
I sometimes miss when I'm like, it's really late at night and I'm like, oh God, I'll do it in the morning. And then I wake up and I'm like, oh, past the morning. And then.
Oh gosh, this morning now I really don't feel like doing it. It's too early. I have to get to school. So that's fair. We're human beings. We're not robots. It's not automatic. It doesn't come to you like that. So it's part of human nature. But then you got to get back on track. So just to see you're not in the minority, there were 2 minor studies done. I was going to make you guess this number, but both of these studies come out to about 41% of the hemophilia population are adherent. Does that surprise anybody?
Surprised me a little bit. That means it's low. It's a low number.
Did not follow. Right, did not follow. Well, absolutely. Correct. I stand corrected. But it's a low number. So adherence, why is adherence important? And don't read the answers. Just don't read the answers. Tell me why it's important for you to be adherent. What happens in hemophilia that makes you need to be adherent?
You get a bleed.
Absolutely. And you don't bleed, you bleed longer. What can happen? You could absolutely end up in the hospital, and you never should take it, you should never think too lightly of what? like a knock on the head, a bump on the head, or something that may very well cause permanent damage or possibly, I know kids don't think about this, long-term challenges in the future. We want to prevent those. There's no reason why today's youth doesn't have to prevent those bleeds if you're doing what your physician says, right? So is that one of your goals? Is it realistic? And everybody's, I'm sorry, but everybody's kind of nodding here in our audience here. It's just kind of saying, yeah.
You know, I always think that sometimes I know with my own healthcare, it's like all or nothing. Okay, I couldn't do it perfectly, so I'm not going to worry about it. Why even worry about it at all? And of course, I know intellectually that it doesn't work that way, that, you know, coming close most of the time is going to be of great benefit. And, you know, and then of course I'll lie to my physician about something, you know, I was like, because I think that that's the purpose of adherence, so that your physician thinks you're a good person.
So you walk in your physician's office and you say, how you doing? And you say,
Fine.
fine. How are you doing with your medications? Fine. I have no questions. That's it? That's all we're sharing?
You know, and sometimes it's true, like we can kind of throw out, if we can't do everything correctly, we just throw out the whole kit and caboodle. Like I know, because it's been Halloween, we've had candy around the house. I'll start having candy from the time I walk by the candy bowl in the morning until the end of the day. I'm like, well, I started in the morning, I may as well do it all day long. But actually someone online just commented, like breaking your healthcare up into pieces and saying, I'm going to take strides in this direction today, eating healthy. If you just commit to eating healthy for a certain period of time, or eliminating one thing from your diet, taking that little step forward as opposed to setting an overwhelming goal.
Just because you stepped off a little bit doesn't mean you can't step back. You know,
Exactly.
so like the all or nothing, I love that because I think a lot of people do that. Like I start on the diet and then, oh, I had the candy and I had the bagel and the cream cheese. Oh, forget it for today. I'm not, for the rest of the day,
Right.
I'm not doing it.
It's a free-for-all day.
This is a free day, right,
Yeah.
and I can stop.
It's a free week, a free month.
Right, and that happens, and you get it, and the ball begins to roll, and then you're just off of your personal healthcare goals. So nothing is different with adhering to the medication that you all need to take. So here's Ryan. See if you've met this guy. So he plays sports, and he was pretty lax. And so what happens? He didn't take the time before his whatever his sport is, didn't take his infusion, so what happened to him? He ends up in a wheelchair for a few weeks because he's got to take care of his bleed. Has that ever happened to anybody? Didn't take the time? No, you guys are great. You never make a mistake like that. You've never had a problem like that.
Cough, cough.
I'm like, these are the perfect people. They are absolutely adherent. They never run off the
I just got a few sympathizers who are sympathizing with my getting lax once in a while. So the people online feel a little more comfortable to empathize with the delinquents in the room.
Nobody's going to tell anybody if you tell the truth here today. So I promise we won't tell. But a couple things about this slide that is kind of concerns me because it's a young boy. He did kind of do this. Sometimes I think friends might encourage him to next time, you better take your infusion because we need you on the team. Might that happen? Yeah, that might happen. The other thing is, he's only going to consider. Does that sound similar? I didn't say I had this bleed. I ended up in a wheelchair. I stayed there for a couple weeks, but it didn't convince me not to do this all the time. Does that surprise you? Yes? Oh, good. So that you learn from kind of making a mistake every now and then, right? And Mom loves hearing that. So, did you recognize yourself in any of these attitudes? How? Tell me how. You can tell. It's okay. I promise we won't tell your physicians. They won't see this. Okay. Do you see, how about with the teenager? Did you see any similarities? Has that anything like that ever happened to you? Never. Well, good so far. So do you understand or maybe give you a little glimpse into the importance of adherence? Just a little? Now, there's many dimensions. This is a fancy little slide to tell you that we don't live in a bubble. So there are other things that influence our personalities and ourself and what's going on in our life to maybe take us off that track a little bit. So just to let you know, our healthcare team, manipulating in the healthcare team, is that easy all the time? Keeping your appointments, going to the physician, talking to the physician in our busy lifestyles, is that a challenge sometimes?
Yes.
So we might not do the communication to the best of our ability. So how about social economic, which means you guys have great social lives, and because of that, that might be a little distracting on staying adherent? No? You guys go to school, come home, do your infusion, go to school, you do everything they're supposed to. We have a great people here.
Again, I guess
Just
New York
perfect.
is New York City because everyone here is like, well, I don't know, maybe we're all just behind the computer.
They're staying in the house, they're not getting outside, so they're not having any challenges. There you go, learn something new every day. How about therapy related maybe? Maybe some of your therapies are challenging. The time of day that you've had to do it, the suggestions, not challenging. We're all good. Gosh, everybody's great here. Patient related, maybe just don't feel like it. Does that ever happen? I just, forget it. I'll do it tomorrow. What's the big deal? And, she just tapped you on the shoulder. I saw that.
Never have your mother sit right behind you.
But he doesn't want to say anything because he wants mom to think he's perfect. But she does anyway, so.
She knows.
Oh, she knows, that's right. So certainly all of these things, like I said, none of us live in a bubble. And I don't care, and also like Glenn had said, it's all about all the medications that have been prescribed for your physician. It could be antibiotics. Do you take them to completion? Do you take care of those kind of things? Do we stay on our diet? All those kinds of things are wrapped up in being adherent to our personal physical goals, right? Yep. How about barriers? And this time don't read the answers. Tell me your barriers, your personal barriers to staying adherent with your medication, as your physician prescribes, as your mom tells you to, because, mom is the boss. So tell me some of yours. Time?
He's only 11, I'm still in control, so.
That's what you don't have any.
So
It doesn't matter. When
It
it
does-
starts getting, more, when I start pissing the rain off more, I guess, we'll probably run into this problem. But for right now, I'm in control, which is how I like it. But so we don't, and he's complaining, no, I don't want to do this today. I don't care, sit down.
Oh, there you go.
We've done,
And Mom-
we just do it, and it's done. And we move on.
But, I think that it's a good point that you bring up. I think every teen would like, every kid, teen or otherwise, would like their parents to feel it's okay, you can back off because I'm going to do what I'm supposed to do. I don't need you to tell me. And the question is, how does the teen give the parents that confidence? In other words, how can there be this gradual proof for any young person of the fact that they can do it on their own, that they don't have to have their mother sitting behind them or next to them, and I know that there's a process to that, but I think that in and of itself, I know when I was that age, I wouldn't have wanted to prove my worth, because then I felt like I was sort of losing that battle. It was like, I'm not going to do what she wants me to do because
or mom's going to take care of that anyway, so I don't have to worry about it. So kind of gradually giving him responsibility might be a good clue to getting started at early ages. Maybe even giving like responsibilities to something in the house and making them responsible for something and giving them some kind of responsibilities there.
That'll remind me if I forget though.
Well, see, then there's a good.
Say factor day. I'm like, oh, get this. Let's go.
So then he's beginning to,
Yeah.
on
he's
his
always
own or
starting.
naturally
Yeah, he's always
taking
starting.
something, right. So anybody else have any barriers?
A barrier for me might just be like, oh, you know, I'll do it later, and like I keep kind of pushing it back sometimes, and then sometimes it just doesn't really get done. And then like I was saying, you know, I'll be like, I'll do it tomorrow, and then you know, I pretty much do actually do it tomorrow, but like it's been a day.
Procrastination.
Yeah.
Procrastination. That never happens with teenagers, does it? Little bit, just a little bit, so that you kind of, I don't feel like doing it now, oh, and then a day goes by, 24 hours goes by, 48 hours goes by. Does mom know that? She does. Oh, good. Mom's laughing. How about, so to realize, you guys, that preventative therapy really is helpful, that you want to stay that. I mean, the goal of your HTC is no bleeds, right? They don't want you to. So hopefully, if you give yourself that little leeway, and maybe you've missed a little bit, but it doesn't cause any damage, and you kind of recover from that. We're hoping that you don't get like Ryan. Yes, sir.
Yeah, just to jump in a little, it ties into this. Rich Pizzillo online just made the point, going back to the conversation about eating, and it applies to adherence as well. One bad meal won't make you fat, just like one healthy meal won't make you fit.
Right.
It's about changing lifestyle. And the same goes with adherence in general. It's not about just doing it in the moment. It's about having that plan and continuing on that plan. And if you deviate, like you said earlier, Linda, just a step back when you step off.
And it becomes a behavior. It almost becomes a pattern of what you do all the time. And it's okay. Like I said, we're not computers. You know, we probably will step off a little bit, but you need to figure out you need to recover and not to have a bad moment or an episode that, you know, that really is ultimately painful. Nobody wants you to have that. So how about, you know, realizing that this is something, maybe teenagers do this too, realizing that this is, you know, mom's taken care of this all of my life. I've never really had a bleed. What's the big deal? It can't possibly be a problem, right? So realizing that this is something that you're going to have forever, and realizing that I have to make this, like Patrick said, as part of my lifestyle goals and processes. How about venous access problems? Is that ever a challenge, and that make you go, you know what, I can't handle this today? No, nobody has that. That's
Does everybody know what venous access is?
Oh, well, good
Access to your
question.
veins.
It means finding your vein. Have you ever had challenges with that? Yes. So what happens when you have that challenge? Well, that's true. You don't give it properly. But then do you kind of like, okay, that's it.
That's
Wait.
when I have to step in and help him if I'm home. If not, then he have to figure it out on his own, and we stick like 3 times till he get it. And sometimes he will let it go on his skin like he could. But then it's an issue for them, but finding the veins is a problem. Sometimes he get it, sometimes he doesn't.
It's a challenge, and sometimes you might want to reach out to your HTC, let them look at how you're doing that, and then see if they could give you any helpful household hints. Has anybody had anybody else had those challenges? No, good. Now I know when we're dealing with the little guys, if there's any little guys can remember this. Trying to chase around the little guy around the house, having to stick them with a needle to get the infusion in. It certainly makes mom feel bad, and dealing with an uncooperative child. You know, and I guess I say that when I'm saying little guys, but I'm thinking teenagers can sometimes be a challenge too. Like, no, I don't really want that. And maybe there's some battles or discussions or chasing them around the house to get their infusion done. So that's some of the things that we're challenged with hemophilia. How about suggestions to improve? And I can't say this enough. If you're having those challenges, like you said with venous access, maybe you sitting down with the HTC and asking, these are my problems, this is what's going on. How can you guys help me? Do you begin to let him like speak to the healthcare providers by himself, Mom?
Oh, yeah, I have to leave the room now. We won't talk at all outside of the room.
But that's okay.
Well, yeah,
Are you
so I
okay
do.
with that?
Oh, yeah, I'm fine with that. But you know, he's been quiet his entire life, as you know. So, but if I leave the room, he will talk to me.
And that's perfect.
So
If
I
he begins to feel, and see, so what you're thinking is that you're not giving him, you know, input into his care, but you really are. But he's taking those roles and he's beginning to being, and that's a big deal, being interactive, talking to the HTCs, talking about the things that he needs questions, that maybe there's some things that they don't want to ask you about. So once again, maybe look to other people in your family. I often try to mention that if you've had challenges, and you guys aren't in college yet, but I met a hemophilia person once upon a time that actually taught his roommate what hemophilia was and how to do the hemophilia, you know, starts and IV starts if he needed to do that, access him and do the infusions. So just to make sure that if you don't feel like doing that one day, you reach out to your mom, or maybe you have other grandmoms. I don't know, anybody teach extended family to be support? No. I've met some hemophilia people that have taught grandmoms, sisters, to just be there to be somebody else. And you guys are laughing. No, you're not teaching grandma.
My mother would run. She runs to the room now, so there's no way.
Well, you know, we all say moms, 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 but I have met family members where the mom was needle phobic and dad was the one that did all the infusions and the care and all those kinds of things. So it doesn't hurt to have other family members, you know, if they're willing, to be involved with that and understand the process.
I think adherence, if I can just say something, is more
Absolutely.
than just, it's more than just about infusing, the actual act of infusing. It's all of my, well, 2 of my children with hemophilia now self-infuse, but what we're trying to, and they have for over a year now, over 2 or 3 for some, but it's about overall care and, you know, keeping track of your medication, seeing how you're feeling, the communication with the healthcare provider, and that's kind of the phase that we're in, is trying to work towards more independence with their complete health program.
Well, and you know, it's like I'm reminded of a conversation I had recently with a friend of mine in Florida whose son is 19. And earlier this year, she announced to him that you were going to order your factor from now on. And he said, why do I have to do that? You should do that. And then, you know, and his parents are divorced, and like, so then he like was telling dad, mom's making me order the factor, and you're going to do it. And he's like, no, I'm not going to do it. You know, so he's doing it now. But
The kid.
you know, yeah.
Okay.
But, you know,
Not the father. Yeah.
but you know, 19 years old, right? It's an adult.
Well, did I hear once upon a time, I heard a physician say to a young teenager, do you want to take your mother to college with you? Do you really want to take your mother to college with you? No, I think not. Maybe, like you said, picking up the telephone, and maybe if you have a question that you'd rather talk to them about, you'd rather talk to the HTC, you'd like to be involved in ordering your medications, figuring what that's all about, and just being involved on your own. That's stepping into adulthood and really taking responsibility for the hemophilia, quite frankly. So no, he might not watch every day, but you really are giving him some independence. So dynamics of teens. Well, having normal teens are unhappy about that. Does that hit the nail on the head maybe? That you're unhappy about doing the infusion, having hemophilia to begin with, excuse me, tongue-tied, and or viewing themselves as maybe different. Does that happen? And what does that do for you? How does that make you feel? And I know saying how you feel is a challenge, but
I guess I feel different from everybody else.
did you feel different?
Yeah, and I can't always
Do the things, do the same activities. So do you talk to your friends? Do they understand? And that's a challenge?
Well, that's not the challenge. Like, the real challenge is that we can't participate in activities. Like, let's say some of my friends are playing football or something, and I play football. I can't play because I can't enjoy myself.
And if you can't hear him, he's saying a lot of times I don't participate in the things or the activities that my other friends can do because I am a hemophilia person. Once you cannot, they prefer you not play football because what? That's a kind of collision sport and you could end up having a bleed, which is not really a necessary thing, so you want to keep yourself out of that. So that's how you feel a little bit different. And certainly, you have to, I always tell this to moms and caregivers, families and friends, that you have to keep an eye on the teenagers because you don't want them looking like this. You want them to be able to step up and talk and honestly say the things you're saying to your mom and your family to kind of get that emotional thing out there. Mom's got to watch because guess what? If you're feeling a little bit blue, you can hide it from her, can't you? Yep. So mom has to watch and make sure that she's seeing what's going on and maybe just keep a little eye on the log or the diary that you're keeping, and I know you're still doing that, but just to make sure that you're taking care of yourself and you're not kind of just, and we're human beings, feeling blue and just stepping back. Yes,
you know, it's funny on that same note, JC, who's a guy living with hemophilia in Utah, he had just said, sometimes I don't want to infuse because I want to be like everyone else. But if I don't infuse, I will not be like everyone else because I will not be able to hang out with my friends and participate in the same activities. So that by adhering to his regimen, it actually helps him feel more similar, which is something I can relate to as well.
That makes sense.
I'm more capable when I have my medicine because I can participate in more. Even if there are certain limits, like football, there's going to be limits, but I can do more when I'm adhering.
And that's hitting the nail right on the head. That's absolutely the bottom line because you want to be productive, you want to be healthy, and you want to do as much as possible. So certainly parents, just keep an eye on those feelings and concerns. Like I said, just in case you didn't think so, they can hide it from you. They can absolutely be happy and whatever, and then go up their room and feel blue and concerned and not participating. So just keep a little bit of an eye on them. Feeling guilty. How about moms? Feeling guilty because they're the carrier. Does that ever happen?
Yes. Yes, that happens.
And now this goes for wee tiny kids or teenagers or adults. Do they feel it? Do they know when you're feeling kind of?
Yeah, I think so. I think he does know what I'm feeling.
So it kind of infuses right into what's going on at home. So and once again, I said that teenagers can hide this stuff from you, but or you think you're hiding it from them?
Sometimes I don't let him, like if I wouldn't let him see because I know he is a bit concerned about it.
I got news for you.
He knows.
He knows. I know. We think we're hiding from each other, but we're really not. They can sense it. So you guys are smiling, so you know that they can sense it. But also siblings. How about siblings? Do siblings ever feel guilty because they just punch their brother? Do you? No. Nobody feels guilty if you punch your brother. Oh, wow. Most times they'll say, oh yeah, my brother feels really bad because then I have to infuse because he just, knocked me off the top bunk. But you guys are saying, no.
Yeah, she'll punch me, but she won't feel guilty.
Oh, she'll just punch you. Too funny. So and I know that we don't have a lot of young kids, but moms feel bad, and well, even for teenagers, I guess you feel bad because they cry because it hurts, because I don't care what you say, a needle hurts, and if you say, oh, this isn't going to hurt, well, it's going to hurt. So if you cry or it feels bad or if it hurts, guess what? Whoever's doing that infusion kind of feels bad about that, except maybe, I don't know, nurses might not, I don't know. Sometimes we can be mean. So you just kind of have to remember that, and I know that's oversimplifies it. Remember that it's not your fault. I know that you feel that it is, but we already established that you're not fooling anybody. Both of you guys know when you're angry or upset, they're feeling it. We think we're hiding it. You think you're hiding it from mom. Mom thinks she's hiding it from you, but really that's not happening. So the communication is key with both of those things. How about, well, we know that the pain of that little needle is certainly less than the pain of a bleed, right? And I point to my knees because that's a place where we get a lot of bleed. So I guess if mom or you guys are feeling guilty, find some place to either within yourselves or some support group kind of setting to let that go, because you are going to share and feel those feelings. So strategies that may increase cooperation during infusion. Do you guys remember this kind of stuff, what you did to kind of get that infusion going without having a problem?
Watching cartoons, maybe? When they were younger, yeah.
When they were younger, watching
TV.
cartoons, watching television, let them pick their favorite programs and things like that. That helps that infusion go pretty well. Okay, so provide maybe rewards. I guess bribes help, huh? Maybe when you were little, bribes help. So how about strategies to help, how about strategies to encourage teens in their treatments? Now, we kind of already talked about this a little bit. So arranging, gathering supplies, ordering supplies, talking to physicians, all those kinds of things. You don't think you're letting them be responsible, but that's really part of letting them be responsible for their health care, which is key. How about this? Teach that bleeds are not their fault. It's what happens, you know, and make them not feel guilty about that. I guess that's kind of a challenge. But also, don't hide it. Do you ever hide a bleed that maybe you just did something you're not supposed to do? Like teens never do things that they're not supposed to do. Never. I raised 2 boys. They never do things that they're not supposed to do. So do you hide it? You walk in the house not limping maybe, trying to hide that from mom. So just realize that you need to seek treatment right away. You know it. I'm just going to encourage you to do it. So additional considerations. Adherence is, do you think that's a surprise? That adherence typically declines in teenagers? What did we say? It's not a surprise that mom takes care of it. Mom's done the infusion. I shouldn't keep saying mom, but mom and dad have kept you from not having bleeds all this time. So now what do you say to yourself? Come on. I don't have to do this. Because look, I've never had a bleed. Nothing's ever hurt me. What do I have to do? I don't even think I have hemophilia. Do you think that goes through the minds of teenagers? So we also know that about the feelings of not fitting in, but it's pointless to take those risks. The football. So encouraging early independence or encouraging independence, self-infusion, mom. There's come a point where we're just going to let him try to do that on his own. Encourage to do things that make them feel better about themselves. So maybe not the football, but how about music, or I know that music, or writing, or I've talked to a lot of hemophilia patients that have taken up have taken up music, and that lasts a lifetime. Sports might end. You know, you hang up your cleats at 25, but music lasts your lifetime, right? So think about things like that. So we talked about allowing teenagers to kind of make their own decisions, good, better, and different. Let them begin to make some of their own decisions. Also give them responsibilities in the house and see that they continue to do them and keep up with them. And oh, mom, by the way, if you've given somebody something to do in the house, don't do it for them. You know, if you've said clean the bathroom, or you've given them, or take out the trash, don't turn around and do it for them, because what happens? They're not going to do it. Why should I do it? Because guess what? If I just leave it there, guess what? Mom's going to do it, because it's going to drive her crazy. So you want to give them responsibilities. So you guys are laughing because you know I know. So we don't want them to make bad decisions that cause consequences. We just need to let them know that some of their decisions might not be so great consequences. So encouraging independence continues. So agree on an appropriate sport. You know, I can't say enough. Reach out to your physical therapy department at your HTC. Find out between you, and mom doesn't have to be there, between you and your physical therapist, and what your treatments are. What is your best sport? Can you come to a conclusion of what you'd be happy to do? Yes? No? Would that work? Does it work? Have you tried it?
Well, they only recommend swimming. You know, our HTC just recommends swimming, right, Deborah? Yeah, they don't give you very much options.
Do you talk to the physical therapist and see what else, see what your interests are? Maybe you could have a conversation with the physical therapist and say, here's some of my interests. I'd like to get involved in some kind of exercise. And I don't like swimming. It's too cold.
You know, that's such an important point. The communication is a two-way street, and the first answer is not always the final answer. So, you know, maybe the PT or the doctor says swimming, and you're secretly thinking football, and the conversation.
So what is the compromise?
Ends, right. So you know, yeah. So say you don't like swimming, but and it's okay to throw things out there. You know, you could say, well, you know, you sure football is, you know, I know people play like flag football, where you don't if I
tackle one
understand it
another?
correctly, there's no tackle. You just grab the flags off the. And maybe that would be okay, right? So, I'm not giving recommendations.
No.
Just saying.
No. But I mean, are there other things that you can do? Walking, is walking such a bad thing? Maybe, I don't know, ask them about riding bikes.
Well, I know even the Hemophilia Federation of America put out a video series not so long ago on running, and how running, if approached properly, can be a healthy form of activity for some people with hemophilia.
Right.
It depends,
Right.
you know, and that's a big caveat to all of this, right? Is all of our bodies are different, hemophilia and otherwise. So what works for one person is not necessarily going to work for the next. But this comes kind of back to the program, breaking barriers. For some people, running can be an effective form of exercise, and maybe you're one of those people you won't know until you start trying to find out. So.
But I think there's a compromise. I mean, it's not only what you like to do. If you don't like to go swimming, and that's what you're never going to do that. So that's not going to give you the ability to do any exercise at all. So you go, oh, well, I'm going to play video games.
Right.
So that's not getting, so there has to be that kind of conversation between you and the physical therapist and what you're doing, what you like. Because guess what, I'm never playing golf because that's a frustrating sport and I would never do that. So if somebody said, Linda, go play golf, I'm never going to do that. So it has to be your interest, what you like, and then who you are and what physically is going on with you and your hemophilia. Yes, ma'am.
So, at the risk of embarrassing my daughter Tyan, because I know she won't share this story, she had difficulty all last year with PE in school, where she had to sit out for a lot of the time. She actually couldn't participate in a lot of the team sports, and you know, where they have the class is like at this auditorium where there's a stage. So she'd actually have to sit up on stage with like the balls coming at her while other people played, and dodge the balls while she sat out. And it became really apparent, and she had explained to everyone, you know, it was in a position where she felt really different. So this year, she actually had a conversation with the school, and they agreed to let her have, she's actually creating an alternative PE program that integrates yoga and Pilates and more, you know, sort of, I'll call it maybe softer sports, or, you know, lifestyle sports.
Not that are impacting your joints.
Exactly. So she, you know, kind of really is pioneering that with the school, but that would never happen if she didn't, you know, send an email to the principal saying, I need to do this.
I need to do something.
I need to do what's right for me.
And we talk all the time about teens being active. We don't want them to sit behind the video games and just eat those healthy meals, but then never get any exercise. I mean, because it's all a part of a healthy lifestyle. So, we kind of talked about that, talking to your HTC and using the resources available, you know, what's going on, and have that communication and come up with some kind of plan together, because they really do want to help you succeed in being healthier. So, take turns doing infusion. Maybe, like I said before, maybe there's other people than just yourself doing the infusion. You know, when you're having a bad day as a teenager, you just, you know, Mom, I just can't do this. Can you please help me out? There's nothing wrong with that. Once the reins have been turned over, it doesn't mean that you can't help them out. So certainly, because treatment is a normal part of life, then that's just part of what you begin to blend into your life, and it's just what you do. So work on hobbies. There's nothing wrong with hobbies, art, music, writing. I've heard a lot of people keep diaries and end up in story writing and things like that, and that helps your mind grow and also keeps you healthy. But we want to say helps you stay in good shape. You can become in sports. We talked about that. And then we also talked about hit it on the physical therapist. Get them involved. Ask them, I want to do something. So, how about hemophilia summer camp? Has anybody done camp? You like that? No? You don't?
Yeah, you did.
It was
Come on.
What did you like about it? That's interesting.
I've never considered summer camp.
Why didn't you like? What didn't you like about it? That's interesting.
I don't know. It was just weird.
Which camp did you go to?
Hole in the wall. Remember,
No,
people are online.
Oh,
Yeah, let's drag someone's name to the mud publicly.
Which one did you
We'll
go
give
to?
equal time. Who liked
Oh, you
it?
didn't like it?
Who liked camp? Who went to camp?
Oh, high hopes.
Did you? And you liked it? Did you? You know, that I think that when people go, you meet other hemophilia patients and persons. And doesn't that make you kind of feel better? That there's other people just like you? So, and you get support from your peers. How about you become a camper and then do you get to be a counselor at some point? How does that work?
When you're like 15, 16, you can like, I guess apply to be a counselor.
Isn't that nice? So 15, 16, after you've gone to camp for a little bit, getting involved, all these people know what hemophilia is, they kind of let you do your thing and make sure your infusions are done, and then you can become a counselor. What a wonderful experience.
Yeah, and I'll just say that it's not only for boys, because I see that up there. So there's actually a camp, my daughter has hemophilia, and there's a camp for girls with hemophilia and other bleeding disorders
Well,
too.
we tend to say hemophilia for boys, but I tell you what, in the last year, I think I've met 5 other hemophilia girls, females, so that it's not just about the boys anymore. So yeah, we do have to include those. And I think a lot of the areas are having now girls camp and boys camp for bleeding disorders and things like that.
We have a lot of girls in New York, so.
You have a lot of girls in New York?
We
Or a lot of-
have- Well, not just in general. In our hemophilia community, I'm not going to say there are as many girls as boys, but there's a lot of girls. And so we always emphasize that we want to make sure that
encourage them
the
to
message
include
is
them.
for everyone.
Absolutely. So know that there's, to manage their disease, certainly talk about it. And you know, I just wanted to point this out too, I guess that's why I paused a little bit, that you guys do know that if you all talk to your social worker, your nurse, your physician, that's confidential information. So that you can step out and maybe ask them things that you wouldn't normally ask mom. I'm getting a grin and, you know, all kinds of things. I know latest things that kids do is certainly piercings and things like that. You might want to just, or tattoos, or I've seen all those kinds of things go on, but ask those kind of things, or things that you don't want to ask mom, because, well, mom's going to say no right off the bat. But just that conversation between you, I'm sorry, that's just to be a trend. And just have those intelligent conversations, the why nots, and actually do that with the professionals rather than just mom saying like no. So, and then certainly, like I said, encourage them to ask their own questions. Helpful tools. Do we have any helpful tools, my goodness, in this day and age to keep you on track? What do you guys use? Bells, whistles, what?
iPhones.
My goodness, in this generation, how could you possibly live without your iPhones? So can you put things in there to remind you? Because somebody said something about going on vacation or traveling. So goodness, if we have that in our iPhone and it dings at us and said today's infusion, you can't possibly forget. Can you? So how many people use their iPhones for things like that? Smartphones, yep.
And there's a lot of hemophilia-specific apps available for people who don't know, including a wonderful one from Pfizer. So check it out.
Well, there you go. But also keeping diaries. Does anybody still keep a log or diaries? Okay, and keeping, well, but that information is important. If you don't keep one, and you keep a list of what's going on in your diary or log as to what's going on with your infusion, can't you share that with your healthcare professional? And can't they get a glimpse of what's going on in your life, and what do they do with that information? They actually make a plan of care, right? They make, you know, maybe there's some things going on that need to be adjusted, and if you do those logs, either on your iPhone or manually. If you put all those little anecdotals in there, then they can make a plan that is specific to you. So what happens then? You're more adherent because it meets your lifestyle and you live better. You have a more productive life. Kind of simple. So in summary, adherence is a common challenge, and that goes in the hemophilia community or any kind of chronic illness that you're dealing with. So it's nothing new. We're not robots, and we have to know those challenges. Despite barriers, certainly work with, talk with, look at friends and family, work with your HCPs and HTCs and HCPs, I did that right, and to make sure your communication is the best possible so that they're treating you and you're treating yourself as best that you can. And then find support from family and friends, just like this. This is an excellent way to get support, because when I'm finished talking, you talk among yourselves, and don't you learn something almost every time we do a program like this? Because you talk among yourselves. So it's also understanding to learn the treatment plan, and just for you all to know that the HCPs want to put together the best treatment plan possible so that you can meet your needs and stay healthy and productive. Okay? So this ends my chatter and my educational series for right now. So I just want to thank you for listening. Hope it made you think a little bit, and maybe stepping into working with Patrick and working forward and become a little bit more adherent for the next handful of weeks. So now I'm going to turn this over to Deb Schachter, and she's going to go over some other resources. Yep, I'm sorry, I gotta get a clicker. There you go.
Thank you. Thank you, Linda. Just very quickly, I wanted to just go through some of the resources that are out there. And Linda kind of ended her talk on kind of understanding everything there is to know about hemophilia. So I just wanted to kind of make you aware of some of the stuff that Pfizer has, and I'll move out of the way. The first one is actually Steps for Living, which is the National Hemophilia Foundation. This is something that Pfizer is very proud to support. They just revamped the website. And it's an excellent resource. It has tons of information, kind of by age category. So if you're new to hemophilia, there's a ton of resources. Teenager, young adult, kind of all those transitions, first job, going to college, going to school. There's a lot of templates on there, letters that you can use, ways that you can kind of communicate with others outside of the community. So I definitely strongly recommend it. Videos, yeah, it really looks great. Pfizer also has a resource called Hemophilia Village, which we're also very proud of. It's also similar, and it's kind of broken down by categories, and a lot of resources that are on there, just as you're kind of clicking around online. We also work a lot with, or support NACHO, which is a conference for camps. I know hemophilia camps came up as something that's going on, and that's a great resource if you're involved with camps, or if you're a counselor, or part of the chapter you want to attend. They have a yearly conference, and it's just a great thing that's out there. And then just quickly, we also work with supporting the World Federation of Hemophilia, their twinning program, where we support their efforts to pair a treatment center in this country where obviously excellent care, with maybe in a developing country where their treatment center may consist of one room. So it's a great way, and the staff go there. So we're very proud to be a part of that. Leading Edge is a program. There's a guy named Big Dog who does a lot of what I would call like outward bound programs. That's something that we also support. And then finally, we have our hemophilia hotline. So if you have issues with billing, reimbursement, that type of thing, that's a hotline that you can call, or your treatment center, or your home care. And there's also materials that I have in the back that have information like that. And then and that's the RSVP program. That's what we call the RSVP program. So it's definitely worth checking out if there's an insurance issue, billing issue. And again, you can call or your treatment center or home care. And then the last thing, we also have a trial program. So if someone wants to try one of our products free of charge, it's something that you can do a 1-month supply. And again, that's something that you would want to talk to your treatment center about if you were thinking of looking at that program. And that's really it. I think that's the last of it. Are you, Linda? Oh, and then last one is, I mentioned that we have a program if you're uninsured. If you are insured, have commercial insurance, and have an issue paying, this is a co-payment card. And again, there's information on the back. So we have a variety of resources. You're welcome to take a look at it. And I really thank you, and I hope everyone enjoyed. So.
Real quick, I just have one little thing. In your packets, you have, and I think I could do two things at once here. Do you want to hold this?
Oh, I'll do it.
Hold this and I'll
This will be my
This
PowerPoint.
is, I get to be bound and white. But in your packet, you'll find an summary for a evaluation of this program and/or future programs. Like I said before, this is our going into our 4th year, and the way that we've come up with programs listed is by getting people's information or requests, I guess, for what hemophilia people need for continuous education. So that's what these lines are for. The rest of this is to evaluate this program and what other programs if you would like to attend. So the educator is Linda Polheimer. You don't have to spell the last name. There's only one Linda. And also location, we're in New York. The date of today is
The 3rd.
the 3rd, there you go, the date of the marathon. And the program sponsor is the New York chapter. Last but not least, we have Living with Hemophilia. You can either fill this out, seal it, and give it back and mail that in, and you'll either get this online or as a periodical, and that's a really nice resource. We also have handouts for just a list of helpful household hints or resources within your packets as well. So that concludes
I was just going to say,
our educational
if
series.
anyone online hears about something but doesn't have it physically but would like it, they can be in touch with us through email or website, and we'll be happy to send them.
Sure,
whatever
if
they
you
like.
have, certainly we want to encourage everybody that if they have an issue in the hemophilia community and would like some more outreach programs, we would love to absolutely look at those, design those, and put those together to meet the needs of the hemophilia community. So that truly ends our communicational series today, and that's all yours.
Thank you, guys. That was a lot of fun, too, with everybody online going back and forth. Nice job, and I don't think we had too much of a lag time, and I have Jen helping me in the back, and she's doing an awesome job, so thank you, Jen. And thanks for all the feedback online. We're going to take a quick 5-minute, get the blood flow, have some healthy snacks, go to the restroom/pool portion of the penthouse up here. So right now, it is 2:29 Eastern Standard Time. We're going to be back here in 5 minutes, so that is 2:34, maybe 2:35. And we're going to do some goal setting, and then we're going to move around a bit with the guys from Super B Fitness. So go ahead and move around. Denver's leading the way on getting up and moving around. We'll be right back in about 5 minutes.
We've been talking a little bit about goal setting. You've heard some talk of goal setting. The reason we want to sort of hammer on that is because our mission, by the time Breaking Barriers ends in 6 weeks, is that together we will have individually set goals and accomplish those goals by the time we're done, because we want to build that discipline in you and reinforce it in ourselves. For me and Patrick, the goal has been with Believe Digi to do groundbreaking work with social media and video production with partners in the hemophilia community. Today is the culmination of that goal. Today is one of the culminations of setting that goal. This is a groundbreaking event, live streaming outreach like this, and it's being live streamed all over the country, and people are chiming in on Twitter and on YouTube and on Facebook with comments and participating in the conversation. So we set this goal, we worked for months and months and months to achieve it, and now we're here, and the feeling is great. And so what we want to do is we want to talk about that and get you thinking about that, so that by the time Breaking Barriers ends, you have that same sort of victory. So real quickly, let's make this a dialogue. What is a goal? Why do we set goals? I'll start with a really easy question. Yeah?
Something that you want to achieve.
Something that you want to achieve, absolutely. Why do you set a goal?
Because if you want to do something, you set a goal.
Yeah, if you want to do something, you set a goal to do it, right? What happens if you don't set a goal?
Then you have nothing to work towards.
You have nothing to work towards, right?
You might not have like a path to it, like you might be like,
Like
I
steps.
don't really know how to do
Perfect.
it.
I love that you use the word path, right? What happens when you get in the car? What do you look at? How do you know where you're going? What's that?
Your phone.
You do look at the road. Ideally, you don't look at your phone.
Oh,
That will
right.
get you a very big ticket, especially in New York, right? You look at a map, right? Or you look at a map before you get in the car. You need to know where you're going in order to get there, right? If you don't have a goal set, how do you know when you've succeeded or failed? What happens when you don't set goals?
You don't know if you succeeded or failed.
Yeah, you don't have a clue, right? It doesn't give you something to strive toward. There are two types of goals that we want to focus on, short-term and long-term. Who's heard those expressions before? Short-term goal, long-term goal. Okay, so everybody's pretty familiar with this. What's the difference?
Short term is like the now and the present, and long term is like in the future.
Absolutely, right? Short-term is more present, more about the present. Long-term is in the future, right? So when you think of short-term goals, what are some short-term goals? Like sort of the generic ones that come to mind pretty quickly. What's an example? Yeah.
To get better grades in school.
Get better grades in school, right? Absolutely. You have semesters, you have quarters. You know that in a month to 3 months, you're going to see those grades in front of you. That's a great example of a short-term goal. What's an example of a long-term goal?
Going to college.
Getting into college, right? Or getting into the college of your choosing. That's a great one. What I love is those are a short-term and a long-term version of basically the same thing, right? So the short-term is to get good grades. The long-term is to get into the college that you want. Okay, so now you've set the goal. Big deal, right? We can all say we have a goal. What do you need to do? What's step one? Once you set the goal.
Make a plan.
I love that, make a plan. And let's drill down even more. We're going to call it an action plan. Why am I being super specific? Why are we going to call it an action plan?
Because it's the actions you do to achieve the goal.
Absolutely, right? So if you just say, I'm going to make a plan. Here's my plan, get good grades. Is that really a roadmap for you? Is that going to lay out the term that you used earlier, path? Is that going to lay out a path for you? No, right? We want to create our action plan, which is the series of steps we're going to take to reach that goal, right? Okay, so we're running a little tight on time. So what I'd like you guys to do is, I just want you to take like 30 seconds to a minute, think for yourselves, what goal, what short-term goal do you want to set for the time you're done with breaking barriers? And there's 3 categories we kind of want to focus on that we want you to pick from or work within. Lifestyle, nutrition, and fitness. That's our focus in breaking barriers. So in the next 6 weeks, when we have our online check-ins in between events and when we have the next 2 events that are coming up, we're going to be doing more, just like after this when we meet with the guys from Super Me. Our focus is going to be more in lifestyle, nutrition, and fitness. So give yourselves 30 seconds to a minute, right? Think about where you are now, and think about, in terms of lifestyle, fitness, or nutrition, where do you want to be in 6 weeks? What is a short-term goal that you can create for yourself and create a little action plan around that is going to improve your lifestyle, nutrition, or fitness? All right, take 30 seconds. And if you're watching online, I want you to take the 30 seconds to a minute as well. Parents, that includes you. You don't get to just point at the kid and say, go make a goal. You're going to do your lifestyle, fitness, or nutrition too. We're going to lead by example. All right? All right, so that was about 30 seconds. Who's brave? Who wants to go first? Who's the bravest? Everyone here is brave. Who's
Here
the
we go.
bravest?
There it is.
Denver. All right.
My long-term, short-term,
Well, you know what?
short-term.
Come up here, Denver. Come up here.
Here we go.
You're brave. You've been on camera before. Get up here. All right, look directly at that camera. Tell everybody watching.
My short-term girl. My short-term goal for the next 6 weeks is to eat healthier food so it could benefit my body in my future, to stay healthy, and to be fit.
Perfect.
Excellent.
All right. And all right. Okay, so now remember, we set a goal, then we create what? Action plan, right? So let's collectively as a group, let's come up with the first step in that action plan for Denver, because it's a great goal. Eat healthier so I get in better shape in 6 weeks, right? Which is great because that's right around when the holidays get crazy and we start grazing every day, all day on all the great food that's around, right? Action plan, what is step one? What is one step we can initiate right away that's gonna help us in Denver eat healthier for the next 6 weeks? What's the first step of the action plan? There's no right or wrong answer. We can kind of brainstorm.
I think starting with, and this is something I have struggled with my entire life, so I relate to it very well. I can't think about what I would want to do unless I start with what I'm already doing. So first I have to look at what I'm doing now.
Okay, so if we look at what we're doing now, let's say we want to eat healthier, right? So what is one thing we can take away? What is one thing we can stop eating that's going to help for the next 6 weeks? Yeah.
The unhealthy foods.
The unhealthy
Fast
foods.
food or junk food.
Fast foods or junk foods, right? All right, so without admitting too much, because I don't want you to get in trouble, what is a junk food that we can cut out?
Junk food, that would be probably
So many, right?
probably soda.
Soda. That is a
Soda.
fantastic one. Absolutely. All right, so everybody heard it here, everybody at home heard it. For the next 6 weeks, we're cutting out soda, right? Now, an action plan, we don't want to just go negative and inactive. We want to be forward-thinking and progressive, not just taking stuff away. So what are we going to replace soda with? Yeah,
Healthy water.
water would be a great one, absolutely.
Or maybe like if you don't want to just like completely go to water, you can do like iced tea or something like a little bit healthier. Maybe not completely, just like water, you know.
Iced tea might be a great one if you still want some flavor, right? Or orange juice. The guys from Super Me Fitness could probably throw out some recommendations as well, right? So we want to create that first step in the action plan. It's not just taking things away, right? We want to take a step forward by replacing something. It's a great one. Let's do one more, or we go through everybody, right?
Well, actually, you know what we should do? Here, let me come up there with you. So just in the interest of time, you guys all got these packets when you came in that have inside an accountability portion where you're going to write out your short-term goal, and then part of preparation is also forecasting what some of the problems may be, what some of the obstacles may be. So for example, let's say you love soda. Well, it's in the house, right? Because maybe your dad loved it. Not throw your dad under the bus. I don't know, maybe he doesn't. But maybe it's going to be around. That's an obstacle you're going to have to, a challenge you're going to have to deal with. So what are some tactics that you're going to use to overcome those? Those are all in your packets. And for those of you who are watching online, we have a link that Jen will shoot out with the hashtag BB Hemophilia on Twitter to the same packet that everybody here has, so that you can do this as well. We will discuss this a bit more as we go to the marathon in a little while. So we can talk and kind of brainstorm as we walk what our goals are and how we might want to tackle them. There's also a log there, so you can, each day, whether good or bad, just log your path. Go back to that word. We all sidestep, just be honest, the log is for you, it's not homework, we're not going to look at it, it's for you. But I think right now, just to maximize our time here with the guys with Super Me, let's clear out all the chairs, let's move all the food to the side, and I'd like to bring up the team from Super Me Fitness. We have Dean, Jaron, and Alan. They're going to lead us through a little introductory workout warm-up session.
Okay, so guys from Super Me, I'm going to have you over here, block the camera for the moment. And we're here facing that way.
Sure, okay. As we get the chairs cleared out to the sides, you guys want to come up towards me. Now this program was focused on the teens in the community, but if there's some daring parents that would like to get involved in the workout as well,
Absolutely.
we won't tell you not to. All right, so when you're ready, come over here with me. Perfect, perfect. And now let's turn our attention to the guys from Super Me Fitness.
All right, so how's everyone doing today? Good. My name is Dean Brown. I'm the president of Super Me Fitness. This is Alan St. Dick, he's the VP, and this is Jaron, he's the CFO. We're all personal trainers. We're all certified strength and conditioning specialists. We believe strongly, the reason why our name is Super Me, that everyone has a super version of themselves. So our motto is unlock that hidden potential. So we're here to teach you how to start, just to begin the entire process of working out. And one of the most important words is going to be progressive. Right? We can't just go from hot to cold. So we're going to progressively get involved in exercise. And also, how you get stronger, progressive. Again, you have to progressively overload the body, and that's how the body responds and adapt to the new changes. All right, so then we're going to get started. Jaron and Alan, they're going to start you guys in with a nice warm-up. So everybody just let's participate and have some fun with it.
Here we go. Now, deep breaths, I like that. Deep breaths.
All right, so briefly speaking, the most important part of a workout is actually a warm-up. That's when you have the opportunity to loosen up the muscles, get some blood flowing to the joints and the muscles as well. So what Jaron's going to do is show you a few things to help the circulation go a little easier through the muscles, and then after that we'll lead you through a nice dynamic warm-up so you can target all the body parts from your toes all the way up to your shoulders, and that way you'll be able to be nice and limber for your workout, and your heart rate will be nice and up and ready to go. Right?
Alright guys, so like Alan said, the biggest thing when it comes to exercise is going to be just warming up the body. Alright, so everybody spread out like arms length apart. Alright, so all we're going to do, just going to march in place. Let's march in place. Swing the arms back and forth, right? Just warming up the lower body, upper body, you know. Make it fun, make it fun. Move your hands however you want to. If you want to take some steps to the side, just anything. Right now, it's not supposed to be tiring. It's just making the body a little warm. Just doing some limbering movements. If you want to take a little spin, anything like that. Just warm up the body, do some arm swings.
So now, this is very important because what you want your blood to start flowing more. You want your body to get loose like a rubber band. So as soon as the blood starts, there's more oxygen going to those muscles that are being used.
Alright, so now that we sort of did a little mini progressive warm up, we're going to go a little bit deeper into it, incorporate some more stretching movements, alright? So, we're going to do, we want everybody to reach up all the way up to the top, to the sky.
On your toes. Everyone get on your toes. Good.
Alright. And just stretch down as far as you can. Try and
hands straight in.
Keep your legs straight. Good.
Can't touch your toes, don't worry about it. It's as far as you can.
Alright guys, now what we're going to do, I want you guys to walk your hands out.
Put the weight on your hands.
Put your weight in your hands and just walk it out. Good.
Nice and easy, walk out.
Good. Now you're just going to come down to the ground. Good. Alright. Now you're just going to press your upper body up.
Just like that. Good.
He made me do this every day when we were training.
Alright guys, now you're going to come back up into a push-up position. Once you just bring your right foot up to your right hand.
So right foot is on the outside of your right hand. Right foot on the outside of your right hand.
Alright, now take your right hand and reach up towards the sky. Open up. Good.
Good. Make
sure you're looking at the ceiling as well. That way you can rotate the entire body.
All right, now I want you to take that right hand, bring it back underneath your left arm.
The left
So
arm.
like reach underneath.
Just like that.
Good. All right, now we're gonna go back and switch sides. So now move that right leg back. And now we got it on the left. Still the
Exact same thing on the left side.
All right, so bring the left foot up. Good. Good, good. Now you're gonna reach the left arm up to the sky. Open up.
Good.
Good. Make sure you're looking up. All right, now you're gonna bring the left arm back underneath the right. Good. And let's step back into that push-up position. You can fall back down. Let's push the upper body up one more time. Good, all right.
A little stretch in the back.
This is the fun part. Now, from this position, you have to get back up onto your feet. So this is gonna be sort of like the progressive part. So you're gonna push up, walk your hands up to the starting position.
Walk your hands right back to the starting position. Push up, push up. Good. Walk right back. Good. Good.
Good.
There
You got it. There it is.
Perfect. All right, let's give ourselves a round of applause. So that's a great way to start to get into your workout. Basically, again, is to just stretch the muscles out so that when you start your actual activity, you don't go into any injuries or anything like that. All right.
And then usually now we'll progress from this to a dynamic warm-up. Dynamic warm-ups are usually much better than a static warm-up. What you just did was more static. So a dynamic warm-up may be a walk. Jaron, demonstrate a walk and a knee lift. Good. So while he's doing that, he's stretching out his hamstrings that are located right here. Pull it all the way out. Do a quad stretch. So your quadriceps are your muscles right here. Everything here is your quadriceps. So you want to get these major muscles stretched out.
And Dean, what's the simplest way to define the difference between a static and dynamic? Is it the traveling through space there?
So right, so a static stretch is anything that's just basically in place. So if I wanted to get my hamstrings after practice, not after practice, like after working out, I'll go straight down and try to touch my toes, and that's gonna get my entire hamstring and my calves included. So that's a static. Now a dynamic means it's in movement. Dynamic, it's in motion. So if I'm walking, kind of stretching that while I'm continuing to move, straight up. And that's the difference between something static and something dynamic. So, I mean, there's a lot of different ways to exercise. I would, one thing you can do, you can always just go on the web and just research stretching, dynamic stretches, static stretches. As I said, it's good to do a dynamic stretch before you start any exercise activity and a static stretch right after.
Can we try one of the, could we do a full length up and down with one of the dynamics?
Oh, definitely. So
That's what I wanted to do, it's a suggestion.
So let's have everyone start right here. Just get some space up. Now, what you're gonna do, just look at Jaron for a second. So what he's doing is walking knee tucks. Okay? Knee comes up, grasp it right here, just below the knee, and you pull all the way as if you're trying to pull your knee to your chest. All right? So we go 1, 2, 3, and switch. So we'll go 1, 2, switch, 1, 2, 3, switch. So I'll keep getting you from the left to the right side. So you guys ready? All right, so we're just gonna take a nice walk into it. 1, 2, 3 steps, and we're gonna pull it up, and then we're gonna continue.
So should we start left or right?
I mean, you can start on any foot that you feel more comfortable on.
Never pointed to the right, so I'm gonna go with you. We'll start on the, you gotta do it. We'll start on the right here.
Okay, so everyone's on the right. Okay, ready? Go. Up.
Up.
Good. Keep going.
1,
Good. Let's go 2 more.
3, 1. Can you bring them all the way back?
Yeah. Keep going.
1, 2, 3.
Good.
step through.
1, 2, 3.
Pull. I'm trying to bring this. You're trying to.
Maximizing the space.
All right. Then you just have a nice, easy jog back.
Oh, we're jogging?
Yeah, nice, easy. Very, very easy. Very, very light.
You guys are a lot faster than I am.
Good, and then we'll stretch the reciprocal muscle. So that's going to be your quadricep, and it's pretty simple. Try if you don't want to demonstrate it. His hand is in the air. He's grabbing his ankle, and he's pulling all the way back. So you're trying to get your ankle to your butt. And it's the same pattern. 1, 2, 3, switch. 1, 2, 3, and switch. All right, you guys ready?
Yep.
Go.
1, 2,
Hands over in the air. There we go. Ready.
1, 2, 3.
All right. Keep going.
3. Good.
That's it.
1, 2, 3. Very good stretches.
There you go, almost.
Keep going. All right, now we're just doing a nice, easy jog back.
This part's fun.
Now I'll just show you one more. So a dynamic stretch for the calves. It's called an ankle rock. We'll go from here, where I take my right foot, place it over the back of my Achilles on my left. Then I'm in a V-type position. Then I rock back, trying to get my heel. So I'll go 1, 2, 3, and then I'll continue up. So let's just all try that. We'll go 10 on each side.
Spread out. Get in that push-up position. Have the butts up in the air.
Good. Make your butt's nice and in there.
You guys feel that stretch?
There we go.
All right, so you rock back and forth into it. So get your heel off the ground, then back on the ground.
Good.
Here we go 10, and then 10 on the other side.
Anybody else got a target of an ankle? Target to an ankle? No? Just me? Again?
And when you finish, you can stand up.
And up.
And one of the most important things, most important thing you can do before you start exercise is consult your physician. So don't just jump into a program, make sure that your physician, your doctor clears you and says it's okay to exercise. Then you progress from there. And if you want any questions, you guys can feel free to email us at info.superbfitness.com or respond with anything. If you want any kind of resources and exercise program, just feel free to email us and then we'll try to help out in any way we can.
Cool, so what are some major takeaways? Starting a workout, what do we learn? What do we need to think about when we start? Well, that's actually a great point, yeah. Specific to having bleeding disorder, you do want to think about your specific joints. Like, for example, the second we get down, start doing those Achilles stretches, I'm very aware of my ankle, right? Doesn't mean I'm not going to do them, but I have to be sensitive to that line between pain and discomfort, right? There's a difference between discomfort and pain. But with regard to kind of like the system, what are some of the things they just talked about? Good takeaways.
You need to work out and like stretch before you work out.
Right? But the first thing we did was just kind of get the full body moving, just get the blood circulating, get the muscle a little bit limber so that we're not just jumping in kind of cold into something very heavy. What do we do after that?
You do dynamic stretches and then after you exercise, do a static stretch.
Right? You want to mix up the systems a little bit, do something dynamic, do something static. And then what was the last thing that we just did after we moved around a little bit? A little of stretching, some more static stretching. Well, I guess we started static, went to dynamic, and back to static, right?
Well, the last one we did was a dynamic stretch for the calves. So then, after you guys determine exactly what your goal is, so maybe you want to lose weight, maybe you just want to be fit, maybe you want to increase your cardiovascular fitness, based on your goal, then you'll have an exercise program or routine that will be specifically designed for that goal. So you have to know your goal when going into the exercise program in order to have the best exercise program in order to accomplish that goal. Otherwise, then you'll just be like a ship without a captain, just going and doing anything. So know your goal, just like they spoke about first, about the goal setting. Very, very important, very key to know exactly why you're exercising and what you want to accomplish. And within that same goal, you want to have your long-term and short-term goal. So say you want to lose 30 pounds in the long run, you have to have a short-term goal. So maybe you lose like 1 pound, 2 pounds, or maybe a short-term goal could just be, let me see if I can be consistent for a week or two. Because with exercise, consistency is key. You can start and have the greatest program for a day or two, but if you're not consistent with the program, then you won't have the results that you need. Because exercise is not just something you do, it has to become a lifestyle. If you're going to want to see results, if you're going to want to be healthy, to stay healthy, it has to be a lifestyle. You have to completely change your lifestyle and incorporate exercise in. So you have to be very aware of that. You have to, like I said from before, you got to set a goal.
It's a lot the same kind of things we heard about earlier in the adherence portion of the program, right? It's not just once or twice, it's about changing behaviors, changing lifestyles, whether it's becoming more compliant to your prescribed regimen or starting fitness or nutritional shift. You have to set the goals so you know what path you're on. You're not just out at sea without a captain, and you really have to commit to the lifestyle. Something for us to think about. We have about 6 weeks together, so we want to set, losing 30 pounds in 6 weeks, that's a lot. You want to make sure you're setting a reasonable goal in this short period of time so you have a better chance of achieving it, right? So if you guys do have any questions for these guys, he gave you the email. You can ask now. He gave the email address at home. It's probably easiest. You can throw them up to the hashtag BB Hemophilia, and we'll redirect online to these guys for you as well. So thank you very much, Dean, Alan, and Jared, for coming today.
Thanks for having us. We really appreciate the invite, and anything else in the future, we'll be happy to help out.
Thank you, guys. That's excellent. Now, if you guys want to grab any more snacks, anything else, in about 10 minutes. What time are we at now, Ryan?
3:05.
3:05. So in 10 minutes, we are going to depart for the New York City Marathon to cheer on people in the 25th mile coming into the 26th, ready to finish off what is sure to have been a long-term goal of theirs. So you have about 10 minutes to use the bathroom. If you want to review the packet, if you want to ask any questions of these guys before they leave, feel free. Likewise, everybody at home, if you want to send any questions in, we got about 10 minutes together before the group splits up, and our live stream will be ended for today. So send those questions in, hashtag BB Hemophilia. Cool. All right, guys. Bathroom, snacks. Follow these guys. Hey, look, we only made you do the whole up and down thing just the one time. It was like 4 times, 5 times. We're almost done. 4 more times.
Do you have the website back? I don't think I remember the website. It doesn't matter what I'm doing. Oh, yeah. So if we all want to see somebody, right? How do we do this? Just like watch what we eat, or we have to work on it? Because we can stick to it. I'm telling you right now.
Exercise on the diet, it has to be right.
You hear that?
They don't have
No junk food. Yeah, you know what? We need something to like kind of like motivate them. You know, to stay on the track. That's what happened to us. We start off good, and like a week or two, we'll just fall off and shift the water. I mean, it's not funny, but I mean, let's be honest.
First, like you were saying before, you have to have that goal. Once you decide that once you start achieving these micro goals, you work yourself with something that you want to subject.
Great. So we'll chat another time. If you want to keep going next week, we'll chat. Pleasure. Thank you.
With validation is always a personal training. Personal training will call it that thing. We have several programs like that. We have a program that's on a subscription where we'll actually evaluate the client, and then based on the evaluation, we'll write his exercise program out. So we'll call him once a week just to make sure he's in the program and that's expensive than having a personal.
Yeah, how much for that?
That is
But that's all the call, or that's, you don't come to the house or anything like that?
Well, we come one time.
Or just one time deal?
We'll show you how to well, we're going to assess you, we're going to show you how to write the program, we're going to show you how to hold and keep on holding and make sure everything is good. So the program goes in is progressive, so it's cycles. So that's how you one cycle. Whereas there's a personal training that's $80 an hour. So there's 220 for the higher and then you get them all.
Yeah. Is she still here? Yeah, she is. Oh, okay.
All right, that's good to keep it nice. But if we have questions, we can email you guys on this and keep in touch with this. Got it. We also want to see some of the limitations we have target joints, which is the knee and the elbow, I'm concerned about, and then he's short. That's more like you. So it's for us, the issue, and then the children, so not really.
I thought you were supposed to bail them or something.
She just let me know that I guess they're not available yet, or
more challenging.
or maybe it's just a preference.
But we'll consider it, and we're hoping, over the next 6 weeks, we could, walk away with at least some kind of achievement.
Oh, yeah. Thank you. Oh, yeah, give me another one. You write it up. Could you write it up, please? All right, you want to give me another one then? No, go write it on. Sure, you get it. Okay, so do I put my name here? My name is here.
Put Denver.
Yeah. She'll copy it.
Yeah, I'm gonna copy it down.
Oh, okay. So thank you so much.
No soda, huh?
No. We don't really drink much of it.
Oh, okay.
Signatures. I'm so easy to see what I'm going to get me. Keep it focused.
Great. Next.
I find it helpful for me when I do a set goal for a diet. Fridge.
Yeah, don't buy anything. I don't buy anything in the house.
I'm gonna break down the one close.
You hear that?
I find it hard sometimes to face with reading all the labels.
I stop buying a lot of stuff.
Yeah.
I'm not sure. Really don't have to.
Okay, yeah, there's 30 minutes.
Okay.
I don't know. That is impressive.
My name?
No, you
So yeah,
put
good. I
Matthew's
mean,
name.
it's,
Yeah, gotcha.
Yeah, I mean Denver's name. Matthew's the boy on boy's name every
You want anything? You want
That's good. That's perfect. No, that's all right. I'll take this one. And then
I did that already.
you give it to her?
Yeah.
Oh, great.
Yeah, I did that.
All right,
I did
here.
that. Speak it to you.
Yeah, all of that. These are the for Denver. This time I'll give it for Denver. Okay, goals, short-term goals, challenges, practice, your first step, and then this is a sort of like a journal track.
So we bring this next time we're coming.
Yeah, I bring it. It's more. It's mainly for
I
him,
would
but
say that.
I think it's a great conversation starter. Okay, if you brought it.
All right. Will do. Thank you.
Yeah.
So I think this is over there in my bag. Everything.
Thank you. Yeah. It was fun. It's going to get fun. Yeah, no, I really appreciate it. I think we have I'm going to fund churches. Yeah. Has a lot of younger kids, ages 6 to like 10, and they're going to need this program. It's a great thing. It's a great thing.
We're back. We were taking a picture of lighted one.
Next year.
Yeah.
The sun's gonna have a great little. Let's come over here.
No, you were great. Yeah, that's great information.
Yeah.
I mean, technically, yes,
There is kind of that disconnect between reality. You can't either condition and medical expectation.
Yeah. Hitler, you know,
Life gets away. And all the reasons that you brought there.
no, I have